Hey there, in this video, I'm going to show you some simple home remedies that you can use to get relief from dryness. These remedies are all natural and easy to follow, so stick around and I'll show them to you right now. PSSST. Hello, ladies. Do you want to know a little something? After decades of pretending ladylike embarrassment, women have embraced the joy of expressing their down there suffering with people who completely understand. Vaginal dryness affects more women than most know. Approximately 30% of American women have vaginal dryness at some point in their lives. In postmenopausal women, the prevalence rises to more than 75%. If you stopped 5 random women on the street and told them about your personal experience with vaginal dryness, at least 4 of them would be able to sympathize. What exactly is vaginal dryness? The flames, the scratching, the crimsonness, not to mention the excruciating discomfort that occurs during and soon following intercourse. These are only a few of the most common symptoms. In some cases, vaginal dryness can lead to urinary tract infections, UTIs, which is the last thing a woman needs when her vagina is already dry and inflamed. Although vaginal dryness and irritation are not to be ashamed of. Some women are afraid to address the illness with their doctors, let alone their partners. What is the reason of vaginal dryness? While menopausal women do experience vaginal dryness, it is not the only reason of the unpleasant condition. Women's bodies stop creating intimate wetness for a variety of reasons. Typically, estrogen is the main culprit. When our bodies cease producing enough estrogen, it can cause vaginal dryness and irritation, among other unpleasant symptoms. Estrogen is the hormone in charge of everything from managing ovulation to increasing a woman's sexual desire. It also plays an important role in allowing vaginal tissue to produce natural lubrication. So, what causes the body to fail in its responsibility to create sufficient estrogen levels? Breastfeeding, childbirth/S depression, full hysterectomy due to excessive stress, immune system dysfunction, medications on prescription. These are just a handful of the many factors that can cause a woman's body to produce less estrogen. But doesn't menopause produce dry skin? Absolutely. Menopause is the most prevalent cause of vaginal dryness, affecting an estimated 20% of all women aged 45 to 64 each year. Most women have erratic periods in the years preceding up to menopause, known as perimenopause. This indicates that their estrogen production is beginning to decline. During this perimenopausal stage, some women will detect the first signs of dryness and discomfort. Vaginal stickiness can be as modest as slight, yet unpleasant, stickiness. It might even be as extreme as continuous burning and agony while having sex. Is it true that birth control tablets can induce vaginal dryness as well? Birth control tablets are disliked by the majority of women. We appreciate the freedom they provide, but we despise the numerous adverse effects they induce. One of these negative effects is a decrease in sexual urge. Oral contraceptives, according to new research, can also promote intimate dryness. Why? Not only does the pill reduce your body's natural estrogen synthesis, but it also increases the production of sex hormone-binding globulin, SHBG. And, when your SHBG level rises, your vaginal tissue produces less natural lubricant. Non-hormonal birth control is the best alternative for those who cannot tolerate the negative side effects of hormonal birth control. Do prescription medications, as well as chemotherapy, dry out vaginal tissue? Absolutely. Chemotherapy induces an abrupt reduction in estrogen production in the ovaries. Dryness happens in the absence of it. Diuretics and beta blockers, which help control blood pressure, can all cause vaginal dryness. Allergy and cold medications can also be used. Some antidepressants cause dry mouth. And, without a doubt, generalized dryness across the body, including vaginal dryness, is one of the most common adverse effects of chemotherapy. Are there any additional factors that contribute to dryness? According to some doctors, eating disorders can cause dryness because they force a woman's reproductive system to shut down. Pregnancy and nursing also reduce estrogen, leaving women with less natural moisture than they are used to. Cigarette smoking can reduce circulation, exacerbating vaginal dryness. Alcohol can reduce feeling and cause dryness. If you intend to be intimate later, limit yourself to 1 to 2 drinks. Swimming pool and hot tub chemicals are also quite drying, so try to limit your time in either. Harsh and strongly scented soaps, douches, and perfumed feminine hygiene sprays all irritate vaginal tissue. Don't let anyone convince you that you need to do any of those things to maintain your vagina healthy. It is self-cleaning and does not require our intervention. What is the most effective technique to acquire healthy relief? Begin by consulting with your doctor. According to research, only 22% of women over the age of 50 are comfortable discussing sex with their doctor. That's insane, girls. There is no reason to be embarrassed of your body's natural functioning, especially the vagina. Consider applying a vaginal moisturizer as well. In the same way that a facial cream keeps your skin moisturized and silky, an intimate lubricant protects the health of vaginal tissue. So apply moisturizer. Also, keep in mind, latex can be harmed by oil-based lubricants. If you use latex condoms, it is advisable to apply a water-based moisturizer. This ensures that the condom can help prevent unintended pregnancy and protect you from sexually transmitted diseases. Water-based lubricants, on the other hand, feel damp and cold when applied. Furthermore, they frequently contain alcohol, which dries and irritates your vagina. For regular use, an oil-based lubricant, together with a lambskin or polyurethane condom, may be a better option. If you want an oil-based moisturizer, choose Crème de la Femme, which is made entirely of pharmaceutical-grade oils. Lower quality oils may include harmful compounds. Glycerin, which increases yeast growth, should be avoided in any intimate product. That's why so many women feel itchy and unpleasant quickly after using a lubricant. Other natural vaginal dryness treatments. Natural relief from this vexing situation is possible with some independent investigation and follow-up effort. Because every woman is unique, it may take some trial and error to find the solution that works best for you. Consider the following when conducting your search. Acupuncture is an option. It can occasionally coax the body back into equilibrium and stimulate your reproductive tract to produce more lubricant on its own. Sea buckthorn pills may be beneficial. This herb has recently received a lot of attention. Many women claim that taking 2 capsules twice daily has returned some of their natural moisture. According to research, it works because it is abundant in omega-7 fatty acids. Consume foods high in plant estrogen. Among these are yams, soybeans, and soy products. However, you should be aware that phytoestrogens can boost estrogen-like activity throughout the body. If you have a family history of gynecological cancer, you should consult your doctor before including these items into your diet. Consume healthy fats as well. Intimate wetness necessitates the presence of estrogen. Furthermore, estrogen is derived from cholesterol. Eat more fat if you want more natural lubrication. But don't go crazy for donuts. Monounsaturated and polyunsaturated fats are best. Try to keep them to less than 10% of your daily caloric consumption. Avocado, almonds, olives, nut butter, tofu, and fatty fish are all good sources, salmon, tuna, or sardines. Caffeine consumption should be reduced. Caffeine drinks are referred to as liquids in our culture. They actually dry the body, especially the vaginal tissue. Stop squeezing. It upsets the vagina's usual chemical equilibrium, causing discomfort and dryness. Best wishes. With a little research and some simple lifestyle changes, you may significantly improve your level of comfort. So keep safe and healthy.